I noticed you started mentioning this this blood test called Galleri. Could you first explain what it is?
So I certainly can. And I do want to start by saying, I'm not a paid consultant for Galleri for this test. This is something that I did a lot of my own due diligence before kind of rolling this test out to my practice. And now it's rolled out through all of our Ms.Medicine locations. This is an incredible blood test that is really changing the paradigm of how we think about cancer screening and early cancer detection. And it's the beginning of a new era. And I'm very excited about this test and what the future holds for precision medicine and precision oncology and all the good things happening with science advancing medicine.
I was really amazed just reading up on Galleri. I think was it over 50 different cancers that could be possibly detected through a blood test.
Right.
And a lot of cancers that don't have other screenings. Is that also correct?
That's right. Why Galleri is like the beginning of a new era is this is a blood test now. It's able to detect fragments of tumor DNA circulating in the bloodstream and be able to identify where it's even coming from through artificial intelligence. And this is just incredibly exciting because it's the type of cancers that everyone knows are the most deadly because people don't have symptoms, right? And so they're diagnosed late, and we know that early detection of cancer, when it's at stage 1 or stage 2, it's much more treatable. And we know that survival, the 5-year survival is 4 times higher if we detect cancer early as opposed to late. Empowering 50-year-old women to go in and say, I want to understand my breast cancer risk. Do I have high breast density? Do you think I need genetic testing, right? I'm having menopause symptoms. Do you really think I'm a candidate for hormone therapy? What about my heart disease risk? What's the data about hormones and heart disease and cognitive decline? And should I be taking hormone therapy? What about my bone health? What about my heart health? Really having conversations about things that we should be empowering women to do to really impact their longevity and their life and their survival, which really, again, it's, I see my 80-year-olds and 90-year-olds, some of them, once a month. So I have a lot of contact with them, but really the impact I have on their life is very small compared to the impact I could have on my 50-year-old men and women.